much for the introduction. It's always great to have the opportunity to meet with people virtually. I wish we were in person. And it was funny to see her slides because at 2 o'clock this morning Eastern time, I got back from Disney World. So it actually was Disney World. And I found out that I hate it and it was really hot. But anyway, I'm here today to talk to you about the impact of diabetes on global population health. And so one of the things we know is we're hearing more and more about population health. We certainly know that diabetes is at least epidemic, maybe pandemic. And so connecting the two and talking about giving people the opportunity to make good choices, I think is so important. So there's a lot of confusion about the difference between population health and public health. And so it's important to think about population health as being that one thing that relates to a group of individuals. So for instance, it might be a group of sixth graders in a certain school. Or it could be a group of people who have the same diagnosis. But it's a group of people who have things in common that relate to each other in the same way. And it has a lot of relevance for policymakers because when they start looking at what kind of opportunities people need in different populations, they need to focus on where their population is, who do they serve, and what are the needs of the people they serve. So what we're really looking at is what influences population health. So what makes a group of people healthy, not healthy? What gives them opportunities? And those are the social determinants of health. And we're going to talk about what those social determinants are. So healthcare professionals, which we are all around the world, and please, I welcome you here, really look at what is our opportunity to work within the social determinants of health. So if you saw the recent Future of Nursing report that came out in the United States from the National Academy of Medicine, there's a huge focus on population health and the social determinants of health. Because as healthcare providers, as nurses, we have the opportunity to be involved, to make a difference at the level of the social determinants. So we can be an advocate. We all know what the health disparities are. We see them in the populations we serve every day. We need to be involved in policy making, and this is something so often that nurses don't do. And if you think about any policy that's been passed down to you from above, right, that trickle down effect, and you get it and you think, well, that is never going to work because the people making the policy don't do the work that you do. So you need to be involved in making that policy. We have the opportunity to improve the health of the people that we serve, to cut their costs, to be more efficient, and to help develop guidelines that really help them. And everybody wants to be healthy. So it helps them in their quest to health. Well, how is that different from public health? So when you think about public health, it's what we do that serves everyone. So think about bike helmets. Everybody should wear a bike helmet. Everybody should wear a seatbelt. Everybody should, if you agree, get the vaccine. Everybody should get the flu shot. This is public health. It's the things that we do that matter to everyone. So it's different from population health. You might have a population that needs a certain kind of care or a certain kind of intervention. For instance, I have a granddaughter who has Angelman syndrome, which is a genetic deletion and causes a lot of really serious issues for her. She's actually in a nursing home. Her needs are specific to her population. Not everybody needs what Madeline needs, but everybody who has Angelman syndrome needs what Madeline needs. So that's the difference. You're serving a population or you're serving the public. And so that's the difference, I'm sorry. So in 2005, the World Health Organization formed a commission on the social determinants of health. So the social determinants are really a couple things. Some of it you can't change, right? You can't change your age. You might want to, but there are some things you can't change. Your race, your ethnic background, those are things you can't change. Those are conditions you're born into. But then what are your chances? What are your opportunities? When you think about times that you go to the doctor and they say you need to eat healthy, can you? Do you have the money to do that? Do you have the resources to do that? Is there a store near you? Do you have the chance to make that choice? So what are your chances to make good choices? And then are you educated about the choices you should make? So this is really what the commission was looking at. You know, what do you come with? What are you born into? What can you do? And do you understand how to do it? So when you look at the social determinants, and we're going to, address them, and you're going to see a side of them, but it's really looking at, do you have what you need for your daily needs? So do you have safe housing? Can kids go outside and play? It's great to say you need to get exercise, but what if it's not safe for you to go outside? It's great to say you need to eat healthy, but what if you have a local market and milk is $6? So do you have the chance to make a choice related to your resources? Do you have access to education? Can the children go to school? Did the adults have a chance for education? Can we pull them together somehow and do education/training with them through churches or communities? How do we do that? Can they get health care? Just because health care is available doesn't mean they can get it. What if they don't have transportation? What if they don't know they need it? And, things like social support, are they isolated, especially through COVID? What isolation? I feel my mother died in May, and for a year and a half, I think she was sick, but we didn't know because we couldn't see her. So we're looking through the window and she's sitting in a chair waving. And I'm thinking, oh, she looks tired. She kind of looks lonely. And she died in May, and we didn't even know she was sick. So what is the social isolation that's happening, especially right now? And then think about, and I know it's in the news a lot, but shouldn't it be? And don't we need to address it? Discrimination, racism, distrust of the government. I don't care where you fall. I don't care what your government is. There are people all over the place and what they believe in and what they support and what they don't. But how does that affect your ability to meet your daily needs? What about people who come in and don't speak English? What about cultural beliefs? So this is the chart you see, and these are the social determinants of health. So you can see that down in the very middle are the things you come with. Now it's interesting, I say things you can't change. You can change your sex, but not really, right? So no matter what you go through, no matter what you do, you are born a certain sex. You have your age, your constitutional factors, your genetic background. You get that genetic test done and you see, oh my gosh, I'm at risk for this, I'm not at risk for this. Then you have your individual lifestyle factors. So these are the choices that you make, either influenced by your social and community networks. So what does the community, what does media say you should be doing? And do you listen to that? How are they influencing us? How do they say what a family should look like? And think about how that's changed. And then all of the things where you have the opportunity to make a choice. Education, work environment, unemployment, rampant right now, in spite of the fact that there's many, many jobs. Do you have clean water and so on? So how do these social determinants trickle down to affect the individual? And how do you as a healthcare provider have the opportunity to make a difference? So when you think about diabetes, you start to think about, well, which social determinants matter? Well, when you think about diabetes holistically, they all matter. What about the neighborhood? Can they get outside? Can they get exercise? Do they have transportation? Can they get health care? Do they understand? Do they have community support, education, and so on? They all matter. But what's so interesting for us in healthcare are the things we focus on. So if you look at the social determinants of health, only 20% of somebody's health outcomes is related to the care and quality of service that they get. So we spend an enormous amount of time influencing only 20% of the care they get, but 80% of their health outcomes are related to the social determinants of health. So again, the physical environment, their health behaviors. Now you see under health behaviors, these are really public health issues, right? But then when you get to the socioeconomic factors, they're different based on population health. So social and physical determinants just are so wide ranging, and they really, I just like to think about it as a chance to make a choice. What is your chance to make a good choice? We know that education is associated with longer life expectancy. We know education is related to improved health and quality of life. We know health promoting behaviors are important in people's outcomes. And then being able to get outside, to walk, to exercise, for kids to play. You know, we're seeing a huge rise in type 2 diabetes in young children because they sit all day. My grandsons are 2 of them. They're 10 and 12. I watched them for a week while my daughter went away for work. I'm like, go outside, ride your bike, bounce a ball. But no, they stand in front of a computer. And as they do that, and they're sedentary, but they're eating their chips and M&Ms while they're playing. We're seeing a lot of type 2 diabetes in young children. And just when you think it's not you, so this is the community I live in, Wadsworth, and this is our local paper. And this was, I don't see the date on here, but it was this calendar year. Never would I thought that there was food insecurity in my neighborhood, ever. So it's around us, and we don't recognize it, we don't think about it, we don't see it, but it's there, and we need to pay attention. You know, if the population we serve for our population health is people in our community, if we work at a local hospital, if we do home health, you know, if we're working in those clinics, our community has food insecurity. Do we know that? And what are we doing about it? And I just like this little cartoon. So, you know, it's really easy to tell someone to eat healthy and they don't understand what it means. And this is, buddy, have you ever eaten a healthy muffin? He's like, I don't know. I couldn't tell if it was healthy or not. So understanding, what does it mean to eat healthy? What's healthy food? Is food healthy on its own, or is food healthy because you need it? And helping people understand the diet and the things that they're supposed to be doing, especially related to diabetes. So look at these numbers. 1980, 108 million people. Look at this 40 years later, 4 times as much. Really scary that 463 million people around the world have diabetes. So, you know, there's always a lag time in the report of data, but in 2017, look at where the diabetes is. Look at it around the world. Now, these are adults. You can see real high numbers in China and India, but look at the United States. You know, a huge number in the United States. We have a lot of work that we have to do. You can see in the United States in 2017, there were 30 million. Now there's 34 million as of last year, a 4 million increase in really 3 years. So what are we doing? What's happening in China? Are there people from China on this call? Put in the chat, what's happening in China? What's leading to these huge numbers of diabetics in India? I was in a meeting in Mauritius maybe 3 years, it was pre-COVID, so it's been so long, maybe 3 years ago. And they had just brought Burger King onto the island. And they were seeing a huge rise in diabetes. So what they did, they put a fat tax on the food so that people wouldn't be as likely. I mean, you know, when you can get around here the 4 for $4, right? And have a huge meal for $4, why wouldn't you? But when they add the tax to it, it became untenable and started to control some of the issues that they were having. So the rise in diabetes is faster in low and middle income countries. And why is that? You know, is that they don't have chances to make good choices. They don't have transportation. They don't have good food options. There's food insecurity. Or is it, you know, the environment, the built environment? Is it fast food? You know, is it the opportunity, or is it cultural? You know, some of their diets, it's cultural what they eat. and puts them at higher risk for diabetes. But what is the cost? So look at the cost of people with diabetes. What is it costing the healthcare system? Just in the United States, $327 billion to care for people with diabetes. Think about if we could prevent diabetes and the sequelae that go along with it, the money that we could save, that we could put towards public health, towards population health. $237 billion direct medical cost. $90 billion because people can't work. So who is this hitting? When does type 2 diabetes generally hit? Young adults, middle-aged, people who still have working years in them. Now they're not able to work. They're going down part-time. They're losing their jobs. They're disabled. It's taking away that productivity that's supporting those families. So what's the economic impact? First of all, catastrophic medical expenditures, really higher in people with diabetes because it affects every body system. So everything, your feet, your eyes, your neuropathy, and so on, every body system is affected. Catastrophic medical expenditures. And then globally, look at the costs, losses in the gross national product. And this is looking at projecting to 2030, which isn't that far away, honestly, if you think about it. And what's the mortality? Look at these numbers. Almost 4 million due to high blood glucose. So they're not treating. Maybe they don't even know. Maybe they haven't been tested. 1.5 million just due to diabetes, but 43% of those deaths, almost half, are in people under the age of 70. Those people that should be out there, should be working, should be the wage earners supporting their family. They're dying. And they didn't just drop dead. So on their way on this journey, all those years that they're chronically ill and lost wages. So why is it increasing? Well, part of it is we're aging, right? The other part is we're growing, so there's a lot more people than there used to be. But it's also these trends towards obesity, unhealthy diets, sedentary lifestyle. We had friends who came over from England pre-COVID, and they're in the community they live in, they walk everywhere, right? It's a little small, rural, just a beautiful place. They just walk everywhere. And after they were here a while, I'm like, well, what do you think about the United States? And they said, you really have a lot of obese people in the United States. And if you look around, it's an epidemic. Unhealthy diets, access to fast food, but also those social determinants. Areas people live in where it's not safe to go outside, where they can't get exercise, where they don't have healthy meal choices. If you get food stamps, or I'm not sure what they call them in different communities, do they take those at a farmer's market? Or do they take them at the little drugstore down the street that carries cupcakes and potato chips? What does it look like? How do you get access to that healthy diet? 1 in every 20 deaths attributed to diabetes, almost 9,000 deaths a day, 6 deaths every minute. If you think about it like that, you start to realize the breadth and the depth of this epidemic. So what did the World Health Organization do? Well, they really had 4 areas they were addressing: prevention, management, access to services, and surveillance. So, boy, isn't prevention the cure? If we can keep it from happening. So when do we start? And we're going to talk about some opportunities for interventions. But how do we teach kids in grade school what they should buy at the store, what they should eat, how they should exercise? My son's a phys ed teacher in a local community. And when their levy didn't pass, the first thing they were going to cut is phys ed. I'm like, oh my gosh, these are kids who at home never go outside. Let them run, let them bounce a ball, let them play tag at school. Don't take that away. We need to look at our policies and legislation. Where do we throw our money? Can we throw our money at places that are more preventative than treatment? And then how do we look at those populations? How do we address what affects one population differently than what affects another. But then when you look at management, what are the clinical guidelines? So how do we diagnose it? How do we treat it? You know, if you want to prevent it, where's the point? Where's the A1C that you get concerned? How do you make those decisions? And then can people get access to what they need? You know, it's great to give somebody insulin. What if they don't have refrigeration? You know, what are things that I see on television all the time, just wear this little patch. You know, what if they don't have access to that? They don't have insurance, they can't get it. And then how do we do our surveillance? What do we know what the risk factors are? Because if we don't know the risk factors in our community, we don't have the opportunity to address them. So they formed the World Non-Communicable Disease Congress. So if you think about non-communicable diseases, these are things that you can't catch, right? So from someone else. So it's not malaria, it's not TB, it's not HIV, it's not the flu, it's not Ebola, Zika.
Yeah, so got it. It just came. It was sent.
I think someone needs to go on mute.
Yes. We have muted all the participants. Sorry for inconvenience.
Thank you, that's okay. But these are things like trauma, like heart disease, diabetes, obesity, cancer, you know, things that we can address based on the social determinants. So what are the key drivers? Well, certainly economics, knowing that when people have suffer from a non-communicable disease, think about someone with diabetes, think about someone with congestive heart failure. If they're not able to work, what happens? Lower taxes for the community, reduced labor supply, you can't fill your positions. You have more expenditures for public health and social welfare. And then what do health systems have? Well, you have more people using the health system. You know, right now, people with COVID, they're so overwhelmed with COVID that they can't treat regular patients. So if you think about diabetes, when people start really overwhelming the system with treatment for diabetes, then other people can't get care. You have very high medical treatment costs, service delivery, a lot of issues related to health systems. And then what happens to the household and the person? Well, certainly reduced well-being, premature death. We talked about the loss of income, their costs that goes out related to healthcare, losing their savings, losing their assets, and reduced opportunities. So look at the trends in deaths. And this was the latest that they had on their website in the WHO. It only goes to 2015. But if you look at 2005 non-communicable disease deaths, so that's the second column from the left, and then go over to 2015, you can see that, look at Africa, for example, they had 2.5 million deaths from a non-communicable disease. 10 years later, it increased by 27%. Huge increases in these deaths from non-communicable diseases. This is our opportunity to make a difference related to the social determinants. So what are we doing globally? Well, in 2011, the UN did a political declaration on non-communicable diseases. They need to be addressed. They put together a global action plan. They had targets for 2025, halt the rise in diabetes. And then they wanted 1/3 reduction in premature deaths. So they put together this package of essential non-communicable disease interventions. They're called the PEN interventions. This is available for free on the World Health Organization website. You can download it, keep it as a PDF, you can print it. It's really, we're going to talk about, but it's really great. And so this was their plan. They want to develop or strengthen preventative, promotive, and curative program to address non-communicable diseases. So what do they want to do? They want to prevent, they want to recognize, and they want to treat. And you can see them here. We talked about them: cardiovascular, cancer, diabetes, chronic respiratory trauma, violence, mental health. So this is their framework, and it's small on my screen, so I didn't realize it'd be so small. But it's really just saying, well, what do we have to do? First of all, we have to recognize there's an issue, right? We have to define what the issues are. We have to come up with ways to address the issue, and we have to implement those interventions. So if you look at preventing type 2 diabetes from a population health perspective, first of all, there's more than one approach. So it's a combination of fiscal policies. What are you addressing in the community related to access to healthcare and who's going to pay for it? Legislation related to creating safe environments, getting parks, places where people can go outside, getting programs where people can access care or can address social isolation, and then get changes to the environment that mitigate healthcare risks and then help people recognize them. So if you look at across a projection of age, what can you do starting in infancy? Something I'm sure many countries are already doing, exclusive breastfeeding up to 6 months, and then make sure that the feeding after that is adequate. How many times, even here in the United States, and I'm a pediatric nurse, have I seen people water down formula to make it last longer, not realizing the issue related to nutrition, not wanting to breastfeed, not understanding how, maybe needing help. Childhood and adolescence, talk about life skills. What happened to those courses that my kids took when they were in school that don't seem to exist anymore? I think about when I was in school, we took home ec and wood shop, right? I can't tell you how many times I used those skills that I learned. But things like how to write a check, how to budget your money, how to start a savings account, how to cook a meal. What does healthy food mean? Make sure they understand the importance of physical activity and create an environment where they can get it. And have those safe and healthy foods in schools. It's really funny. My youngest grandsons are 10 and 12, and we got to have lunch with them at school one day. And I know they did this big healthy lunch thing at school, and they do. They sell a healthy lunch, but my grandsons don't buy it because on the side, for 50 cents, you can get a bag of chips, and for a quarter, you can get 2 cookies. So you don't have to buy the healthy lunch to buy the junk on the side. And there's nobody there helping them make the decision. So how do we educate them about what they should be eating and why? And then all you have to do is watch television Saturday morning, and you'll see all the ads for the sugared cereals and so on. How do we stop that? And then what do we do about vaping, tobacco use, alcohol? Look at the movies that are out. What are the kids seeing? There's a big uptick in smoking in adolescence and vaping. How do we address that? And then for adulthood, what are our opportunities? Making sure these mothers and pregnant women are okay. Continue with alcohol prevention. Make sure people can get their food, help them get outside, and help them understand ways that they can prevent disease. So in 2016, the WHO coined the World Health Day on diabetes. And so this report is also available online for free, but they believe, and I do too, that diabetes can be delayed or prevented, that diet and physical exercise work really well and we need to encourage it, and we need to have a high-risk approach to address those social determinants to make a difference. So healthy workplaces. Now, I'm really pleased to say the place where I work got everybody a stand-up desk. So you can, during the day, stand up and do your work. But, they say sitting is the new smoking. Get people out of their chairs. Have them use the steps. Have them walk around, not sit in a chair all day. A lot of places, and you heard the last speaker, they have those mindful rooms. The place where I work has something called a Zen den, where you go in and there's a diffuser, I think it's eucalyptus, that's putting out They have different discs that you can play, ocean sounds or the wind blowing and so on, or just real light music. They have a focal point on the wall and the mat on the floor if you want to sit and look at something. You can dim the lights, really help people be healthy at work. A lot of places have Zumba classes, they have aerobics, they have walking challenges. The hospital where I used to work had a path, and you knew if you walked this far through the halls, how far you'd walk. They handed out pedometers. So everybody, people probably don't need those anymore with their watches, but, really help create healthy workplaces. Let's look at the schools. Let's educate these students. Educate them about, shopping the outside of the grocery store, not going up and down the aisles. What choices can they make? If they need one thing, how do you pick between one thing and another? Have a cooking class. And if you can't do it in the school, do it in the churches, do it in the community. How do you make simple food that's healthy for them that they can eat? And then again, you see them here, playing ball, get them outside. And the schools have that phys ed. Teach them little games that they can do at home. And then how do you manage it? Well, those Penn interventions that I talked about have standard guidelines and protocols that you can use to address diabetes. Let's get a small set of medicines that's available to everyone. Encourage that diet and physical activity, teach these patients, and let's screen them. Make sure they have access to affordable insulin. And it's interesting, if you look at the second bullet, low-income countries pay more for insulin than well-resourced countries. Why is that? Why is that? And only 23% of low-income countries say insulin is even available. That's something that we need to address. And let's look at early detection. How do we address end-stage renal disease, cardiovascular, blindness, lower limb amputation? How do we prevent it? How do we watch for it? So now you have someone, right? So you haven't prevented the type 2 diabetes, right? But let's prevent the sequelae. Let's know what they are. Let's measure for them. Let's recognize, let's teach them about them so they understand the importance of proper footwear, for instance, getting their eye exams. And then we need to integrate it with treatment of other things. So in some settings, it is with TB and HIV, but it also can be with congestive heart failure, cardiovascular disease. We need to integrate it, treat the person, not the disease. And I know I'm pretty quickly running out of time, but have a national plan. You can see that about 68% of countries around the world have operational policies for diet and physical activity. And then the ones that have the policies, only about half of them have implemented them. So look at your country's policies. If you don't have one, write one. If you have one, help get it implemented. Make sure that what works is being heard by the legislators and by the policymakers. Make sure there are national recommendations, national mechanisms to address this. Look at health ministries. What do they know? How are they treating it? And really look at overweight and obesity. Strengthen your health systems. Get that van out there into the communities, address people where they live, help them understand, really look at their knowledge and their education, teach them on their level, and then look at the data, try and identify the trends. So I really thank you for your attention. I think the speaker before went a little bit over, so I tried to fit within the time. I welcome any questions if you have them, and I'm going to quit sharing my screen.